There's a lot of things I'm curious about. I'd say the most interesting topic nowadays is the anterior cruciate ligament, the ACL, which is, always a common sports injury, whatever sport it may be, whether it's soccer, football, and obviously this time of year, American football is kind of at the tip of everybody's tongue and all over our television sets with the both college and pro football playoffs ongoing. Well, my name is Dr. Bruce Stamos. I'm an orthopedic surgeon at Hackensack Meridian Medical Center, Ocean Medical Center specifically, a orthopedic surgeon who specializes in sports medicine.
The ACL injury, kind of an unexpected injury.
It's a sudden injury, so it just happens. It's a non-contact cutting injury generally, so the athlete will be at 100% in the middle of their sport. Oftentimes it's just the simplest thing is they land off balance or they go to react to something that's happening around them, and they're maybe just a little off balance or concentrating on something, and they plant their foot and they just load their knee kind of in the wrong direction rather than flexing the joint. It hyperextends or just gets stressed in the wrong direction for that split second, and that's all it takes. So people are always like, "Oh, I'll strengthen my legs, avoid injury," and that does help to some degree. But a lot of athletes that tear their ACL are in peak shape. It's not something they haven't done. It's just a unfortunate misstep or accident.
Is there a way to kind of predict that maybe the ACL is weaker or at risk?
You know what? There's definitely certain athletes that are more at risk. Females are definitely more at risk than men. So we know that a high school female athlete is anywhere from 3 to 5 times more likely to tear their ACL. And, the most common theory, I mean, there's a lot of different theories of why that is, but the most accepted, it's really biomechanical. Women tend to have a little bit wider pelvises, which means their knees bow in a little bit more, and they tend to participate in athletics a little more upright, a little less flexion in their knee, which kind of predisposes them to the injury.
So is there a way to then work on that biomechanics in some ways?
Yeah, there is. I mean, there's definitely been some because college soccer players and female high school soccer players is probably the most common athletes that we see ACLs in. I mean, soccer in general is just obviously it's a lower extremity sport, it's a cutting sport, so we see a lot of ACL injuries in soccer. And there was a orthopedic surgeon out in Santa Monica, out in California, who was one of the physicians for U.S. Soccer that developed a training program to see if they could actually affect a change in female soccer players as far as ACL injuries. And they were pretty successful at, a conditioning program that helped to lower the incidence of ACL tears. And basically, they would take teams and they would do the program with one team and not do it with another set of teams. And they compared the outcomes through a season, and they definitely found significant, like 30 to 40% decreased injury in the teams that were doing the programs.
So if we go back a little bit now and look at the Super Bowl that's coming up, and for football players, what are some of the risks leading up to the Super Bowl and in the Super Bowl?
I think this time of year, especially like with football players, I mean, it's a long season. I mean, and the NFL has actually lengthened their season recently to 17 games. So it's really grueling. And we do know that as the season goes on, the amount of injuries certainly goes up just from wear and tear. So, it's the usual things, especially with the playoffs and the Super Bowl. Like the team that's healthier tends to have, better chance. And there's always significant injuries at this time of year, and there's always players that are nursing different things. So, I mean, I know the medical staffs of the respective teams are definitely doing their best to keep everybody on the field.
It always seems like professional athletes get injured and come back so much more quickly than the non-professional athlete patients.
Right.
Why is that?
There's a lot of reasons for that. I mean, one, it's where they're starting from. I mean, they're at the highest level, and that certainly puts them at a little bit of an advantage. But they also have to get back to the highest level, which makes it harder. It's I think when you're not personally going through the injury and you just see, oh, they're back again, like you don't really understand or see what they're going through. But it's they do have these professional teams because they're this football is so huge, such a huge industry. I mean, they do have incredible medical staffs from athletic trainers to physical therapists to the team physicians, they have around the clock care. A normal athlete goes to physical therapy. One of my high school kids 2 or 3 times a week after, they have ACL surgery or shoulder surgery. I mean, these professional athletes are getting therapy probably 2 or 3 times a day and working out on their own. So they're doing everything they can. I mean, there's some injuries that, no matter what, biology is biology, and it takes time for you to heal and really get where you need to be. But obviously, once they get to that point, they can really do things at an accelerated rate.
What are maybe more specific ways that medical teams are protecting the players with so much pressure and leading up to the Super Bowl?
With the NFL, it's pretty amazing how advanced the medical care has become. And it's funny because injuries will go through teams where like everybody will dislocate their shoulder one season, not everybody, but a large number of players. So then, the coaches are always like, what can we do to stop this from happening? It's like whatever injury went through the team, the next year, it's always like, what are we going to do to not make sure that doesn't happen again? And I think, they do everything they can to prevent injury, and they've gotten so much more sophisticated at doing that, really through trial and error. I mean, when I was with the Patriots, we had a new strength and conditioning coach, and he was like into plyometrics and lunges. So he had all the athletes doing lunges and kettlebells, and next thing you know, like a third of the linemen had anterior knee pain and couldn't even walk. So we're like, you just gotta, so some of it's learning from your prior mistakes. But it starts with training camp when they get weighed in every day and they're making sure they're staying hydrated all the time, to the point where they're checking their urine and weighing them in every day to make sure they don't lose too much weight with every practice. And although they can't keep an eye on them in the off season, they're definitely given programs to work on in the off season. And, it's just never ending, the things that they now track and follow, and the nutritionist and the physical therapist and the massage therapist. So they have a staff that's constantly trying to keep them healthy.
And what about that peak performance and training really hard to be in the best shape possible, with also maybe not overdoing it and then causing injuries?
I think that's a fine line. And it's funny. I all the time have patients try to pin me down on what they can do and what they can't do. Like, how many of these should I do and how much weight should I use? And I'm like, it's very individual. And I think that's, and some of it again is trial and error. Like, you need to push your body. You have to see how it responds, which unfortunately, most of the time, you're not going to know the response until the next day. So, I always tell patients and, athletes to, you can push it, but then you want to give your body a chance to rest and recover and see how your body responds. If you're getting progressively more sore, depending on what you're working, if you're limping, if it's just you're not recovering, then, obviously you need to rethink things and kind of restart and start again, maybe less intense, but it's hard. I mean, CrossFit was the huge phase, and we saw tons of people hurt themselves. And, you can push yourself so far until you push too far. And unfortunately, a lot of times you don't know that's the case until it's too late. So I think, that's another thing. Like with these professional athletes, they wear things that monitor the heart rate. They know exactly how much output they've put in at each practice. And they do a good job of trying to monitor that and really see what that threshold is for injury. And again, it's from trial and error and really learning, what the body can sustain and not break down. And that's really what it's all about. And because there's so much on the line, they become better and better at doing it, to the point where it's amazing.
What would you say is the biggest injury risk that football players might have?
Right now, or this time of year, they probably have 10 to 15 players on each team that are nursing something. They have something that, their training staff knows, and they're trying to keep them on the field. The most common things we see are straightforward: strains, sprains, contusions, which are just a bruise. So, that's probably 65% of football injuries, just simple as getting a helmet to the thigh or a helmet to the calf, and you bleed into the tissue, it gets swollen, the joint gets stiff above and below. And those type of things are really common. I mean, a running back in the NFL, like how many times do they get hit in a game? So they just, they have bruises all over their body. And it's just a matter of not getting hit in the same spot like 2 weeks in a row, and stuff like that are just constant. And then, there's the person that turns their ankle and has an ankle sprain, and, you're trying to get them back as quick as possible, shoulder separations, shoulder dislocations. A lot of these things may be surgical, but if they happen in season, you try to rehab them and get them back on the field and try to get them through the season and then address it afterwards, and probably at the end with each team at the end of the season, they probably have, anywhere from, 5 to 7 athletes that are going to have surgery with something that happened during the season they were able to still play with, but it still needs to be addressed once their season's over.
Are shoulders the most common injury?
Lower extremity is higher incidence than probably 2/3 of lower extremity, 1/3 upper extremity. But yeah, upper extremity shoulder instability is really common.
I cannot imagine. I mean, even the wide receivers that they catch the ball and are immediately knocked down by their legs. I mean, what kinds of bruises they must have.
They, they do. It's amazing. I mean, I'll tell you, to be on the sideline and stand there, and I can remember being on the sideline, and like if they were coming anywhere near me, I was backpedaling because the amount of the speed and the size of the people playing. I'm not a big guy, so I mean, I knew if they hit me even accidentally, it was going to be a problem. So they're and they've only gotten bigger, stronger, faster. So it's crazy. Once they're done playing, they got to get smaller quick because it's not healthy to be that big. But it is amazing how much mass they can carry when they're playing.
And it must be difficult then to do that because you build a life of kind of a certain level of consumption.
Yes. No, I think that's probably the biggest challenge for these ex-players is getting down in weight and getting, and changing that, exactly right. The amount of calories they were eating and consuming and burning, and, getting their metabolism adjusted to their new life, so it's so important because, the average age of an NFL lineman is like in their 50s. So it's it definitely takes a toll on them.
Within orthopedics, are you using like PRP,
Sure.
stem
So
cells, and what's the difference?
there's multiple kinds of stem cells, and there's certain limitations that we have in the United States that they don't have in other countries. So you'll hear about athletes going to Germany or Mexico where, and mainly that's growth factors and some different things that we're not allowed to use in the United States. But, basically PRP is platelet-rich plasma. It's taking the patient's own blood, and then they spin it down in a centrifuge to separate it. They add a little reagent that separates out the platelets. And platelets are what I would call pseudo stem cells. They're not as potent as stem cells elsewhere in your body, but they do have the ability to change into any type of tissue or any type of cell. So, what we do is we take a small amount of serum. So you draw like 20 cc's of blood out of a patient, and then you spin it down and you get like a couple of cc's, a little bit of a fluid that's the serum that has those platelets, and then you inject it to cause a healing response, and in the NFL, they use it for muscle strain. Someone strains their hamstring, they inject it into the area where the muscle's injured. They use it in tendons that have chronic tendinopathy. A lot of the linemen that play in the NFL have patellar tendonitis or quad tendonitis, which are the major tendons around your knee, and they get chronically torn and worn from a long season, and they can inject that into the area where the tendon really isn't healing quick enough to try to encourage a healing response.
So right now, what type of stem cells could be used in the US?
We can take them from fat, bone marrow. The thing about these growth factors is they can make the cells proliferate and become even more powerful, and it also causes cellular mobilization. And for whatever reason, those aren't legal in the United States. Professional athletes are really good at finding ways to improve themselves, whether like growth hormone or testosterone, all those things that are not legal in professional sports. And I think they're always looking for that edge to improve things. So I mean, I think that I know a lot of athletes that have gone overseas in the off season to try to heal nagging issues and have been successful.
Mhm.
you know.
What fascinates you most in orthopedics?
Certainly technology in orthopedics is advancing at such a fast rate. And, it's a very technical field, and, we use instruments to perform surgery, and with arthroscopy and minimally invasive surgery evolving so quickly. Like, we used to not do shoulders arthroscopically. Now we're doing hips arthroscopically. So, like, it just keeps improving what we can do with really quicker recoveries and less pain and less invasiveness. We deal with a lot of younger patients, so there's so much on the line. I think that technology, and with all the breakthroughs that are going on, I think biologics are going to be huge. And like I said, we're not really there with them. And I get asked about them on a daily basis, which is a little torturous, because I wish I could say, oh, go do this stem cell treatment and it's gonna cure this partial thickness tear that you have in your shoulder, or go do this and it's gonna help the cartilage heal in your knee. And I do think we can get there. It's just we're just not there yet. So I think biologics are probably the biggest, thing I would say in the horizon. I mean, right now, and I've probably done 20 of these procedures, for let's say I do 100 ACLs in a year. I've done 20 repairs on younger patients where I actually suture the ACL together, and then we lay a collagen sponge that we soak in their own blood over top of the repair, and it allows the ACL to heal. And that is like huge, because if you're successful in doing that, you've basically not put a graft in there that serves as their ACL. You've gotten them to heal their own ACL, which still has proprioceptor or nerve endings in it. So it is a better structure that will lead to a longer lasting knee, a knee that doesn't wear out as soon. Because even with doing an ACL reconstruction, putting a new ACL in the knee, we don't restore the mechanics exactly to what they once were. But by repairing it, if that ACL can heal, we can really restore the joint to what it once was, which is pretty amazing. We even see in successful repairs that the rate of injuring the other knee is less. So it definitely, it's new. It's only been out for a couple years in the United States, or being done in the United States for a couple years, where we're actually using the sponge. So I mean, I think those things are going to be real game changers in the way we treat injuries. And we have them for shoulders too. We have collagen patches for shoulders. People are working on collagen implants for meniscus, which is the cartilage cushion in your knee. So there's definitely a lot of things to get excited about.
And why did you decide to go into this field?
Well, I have a unique background. My parents were actually teachers, and then my dad was doing construction in the summer, and he actually decided the year I was born to start a construction company. So I grew up, working on construction sites, usually just cleaning up, or, loading cinder blocks, or whatever manual labor they could find for me. So when I finally decided I wanted to go to medical school, like, orthopedics was a natural progression, because it was the most mechanically minded, hands-on field in medicine.
Mhm.
You know, Orthopedics is awesome in that we actually get to fix things. Like, a lot of medicine is just preventative, or you're basically just treating something, or nursing it along, not really curing it. Like, with a rotator cuff, if somebody comes in, after diagnosis, we do surgery, repair them, they go to therapy, and at 4 months they're better, and hopefully back to 100%, and we can, they can go on their way. They may come back for something else, but we actually took care of the problem, addressed it, and got it better.
Mhm.
So it's pretty gratifying in that regard also.
Thank you so much, Dr. Stamos. It's such a pleasure to talk to you, and you have a really unique experience, and your curiosity is also really appreciated.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.